In a constantly evolving world, accurate information is power. Our program offers you in-depth analysis of public policy, healthcare advances, and crucial research. Turn knowledge into action. El Bujo Investigador, your trusted source for leading the future of healthcare.
Hello and welcome. So today, we're going to dig into a really landmark strategy from the Andean region. It asks this really fundamental question. What if we could actually design our society to close the gaps that decide who gets to live a long, healthy life and who doesn't?
And this quote from the World Health Organization, wow, it just gets right to the heart of it, doesn't it? The gaps we see in our societies, they're not just abstract numbers. They are, quite literally, a matter of life and death.
And this isn't just some philosophical debate. It is a stark economic reality. Get this, it would take an average person in the Andean region 90 years, 90, to earn what one of its billionaires makes in a single day. Think about that. A gap that huge, it doesn't just impact your bank account. It shapes your entire existence.
This kind of disparity creates what public health experts call vital inequality. And it's such a powerful concept. The idea is that the inequalities we literally build into our society, they translate directly into unequal chances at life itself. It means we can measure the gap not just in money, but in years of a person's life.
Now, what's really fascinating here is when you break down who is carrying this heavy burden. The data time and again shows that poverty, and with it poor health, isn't spread out evenly. It's concentrated in very specific groups, especially folks in rural areas and in indigenous communities. And these aren't just coincidences. They are clear historical patterns.
And this table just makes that connection so clear. Okay, so the Gini coefficient, just think of it as a score for economic inequality. The higher the number, the bigger the gap between the rich and poor. Now look at how it often lines up with life expectancy. It's a complicated picture for sure, but you can definitely see how high inequality and lower life expectancy can go hand in hand.
So, faced with this massive challenge, 6 Andean nations realized they couldn't go it alone. Through the Andean Health Organism, they decided to team up to forge a coordinated response that aims to tackle these inequalities right at their source.
Now, the policy's main goal is huge, but it's crystal clear, to hit that UN goal of good health for all. But, and this is the important part, this goes way beyond just building more hospitals. It's really about re-engineering the entire system to get at the root causes of inequality, and to do it together as a region. So how in the world do you even start to build a policy this ambitious? Well, you have to start with a rock-solid foundation. Let's take a look at the 4 guiding principles that basically make up this policy's DNA.
And this brings us to a really crucial distinction. As the slide shows, equality is giving everyone the exact same pair of shoes. But equity is giving everyone a pair of shoes that actually fits. This policy is focused squarely on equity, on giving people the specific support they need to have a fair shot at being healthy.
This commitment to equity is grounded in something that's just non-negotiable. Health is a fundamental human right, period. It's not a product you buy. It's not a privilege for the few. It means that quality services have to be available and accessible to every single person, no matter who they are or where they live.
And to make that right a reality, the policy zooms out, way out from the clinic, to focus on the social determinants of health. You know, these are the conditions of our everyday lives, our income, our schooling, the air we breathe, that have a massive impact on our health long before we might ever need to see a doctor. And finally, the policy champions what it calls interculturality. This is about so much more than just respect. It's about recognizing the incredible value of the region's diverse cultures. It means actively weaving the traditional medicine and ancestral knowledge of indigenous and Afro-descendant peoples into the national health systems, not just treating it like an afterthought.
Okay, so principles are essential, but how do you turn them into an actual plan? Let's look at the blueprint, the strategic lines of action that bring this whole vision to life.
The strategy has this really logical flow. First, you have to monitor the problem, because you can't fix what you can't see, right?
Then you empower the people on the front lines, the health workers, and get different sectors to collaborate. That work gets backed up by stronger governance and smarter policies, all while you're constantly sharing that knowledge back with communities so they can help drive the change. It's a full circle.
So to execute this massive plan, the policy is really zeroing in on 3 critical tools that are absolutely essential for making this transformation happen. First up is the Health Situation Analysis, or ASIS. Just think of this as a super deep dive diagnostic tool. It's a systematic way for a community to look at its own unique health challenges and the social factors behind them. It basically creates an evidence-based roadmap for local action.
Second, there's a huge renewed focus on primary health care. The goal here is to completely shift the center of gravity of the healthcare system, making it proactive, community-based, and focused on keeping people well right where they live and work, not just treating them when they get sick.
And third, you guessed it, leveraging the power of digital health. This means using technology, things like electronic health records, telehealth, to close those access gaps, especially for rural communities, make services more efficient, and empower patients with their own information. Of course, a plan this huge needs fuel for the fire. That's what this 6% is all about. It's a shared promise, a commitment from the Andean countries to invest at least 6% of their GDP into public health. That's the financial muscle needed to make all this transformation a reality.
So when you put all these pieces together, the principles, the actions, the tools, you start to see that this isn't just about healthcare reform. It's really about a much, much bigger and more profound vision for the future.
The ultimate goal here is to build a society of care. And that phrase represents a massive shift in thinking, moving away from a society that's just organized around economic growth and toward one that's centered on the sustainability of life itself, for all of us and for the planet.
And so, this entire policy really leaves us with this one huge, provocative question to chew on. What if our health depended less on how much money we have and more on our collective well-being? Ultimately, the Andean Health Pact is way more than just a policy document. It's a roadmap for social justice. It's a bet that the healthiest possible future for everyone is one where we finally close the gaps that divide us. Thanks so much for joining us for this explainer. Be sure to follow our account for more deep dives into these complex topics. We'll catch you on the next one.